Hello, my name is Margaret from Emakoff Health. Today I'm going to do a video on how to become a healthcare consultant. And in this presentation, I'm going to lay out all the 5 things we need to know before becoming a healthcare consultant. A healthcare consultant or consultancy is a great field in the United States of America and in other parts of the world at large. In this presentation, we're going to just go down from the top to the bottom of all that you need to know before getting into this career. First is compensation. Each and every company have compensation to give when you work in that setting or in that environment. And according to the Washington D.C. based George Washington University Milken Institute School of Public Health report, compensation come in different forms. In a management consultant's base salary average is over $131,000 annually. In 2015, the median salary was $131,613. Additionally, many top firms provide high-fee performance bonuses. Roughly 25% of the basic salary, as well as signing bonuses, which can range from about $25,000 to $35,000. So these are the compensation mostly awarded for this particular career. Healthcare consulting career cannot flourish at every corner of the country. Definitely some areas there might be a high demand, and that is where you'll be able to find your niche, or you'll be able to perform better or have a good salary. The highest demand for consultants is in large metropolitan areas. For instance, New York City, Seattle, Washington, California, some highly or densely populated environments or locations, Texas, Dallas, Houston, Texas, Austin, Texas, Georgia, Atlanta, Illinois, Chicago. All those places are highly or densely populated, and those are the areas where you can easily find most of the healthcare consultant position or jobs. Settings where you can find those jobs is in hospital settings, both the private and the government hospitals, the teaching hospitals, and also other specialty hospitals, pharmaceutical industries, government agencies like Health and Human Resource or Health and Human Service, and other privately owned businesses or healthcare businesses. You'll be able to find a healthcare consulting position in those areas. The largest concentration of healthcare consultants is about 26.1%, and this is currently located in the southeastern part of the country. Just put a map of United States of America down, and then you just divide it into four. You already know exactly where to locate southeastern. It's stretched from Georgia all the way past through Illinois. Illinois is almost in the central, probably pass by and end somewhere around Illinois. Illinois, no, not Illinois, but I think it's Louisiana. Sorry, yeah, from Louisiana down to Florida. That's the eastern, southeastern, that area. That's kind of almost. And the second highest concentration is in the middle Atlantic regions, where you'll find 18.2% of the healthcare consultant positions available in those in the mid-Atlantic regions. You can also get about 16.7% of healthcare clients that are based in the western part of the country. So there's always an opportunity in various areas when you are considering healthcare consultant's position. Type of work. Based on percentage of revenue, the healthcare consulting firms focused first and foremost on 36.8% strategic management. So most of these healthcare consulting firms or companies need knowledge in strategic management. If you have an expertise in these areas, you will be a best fit or be the best candidate that these firms will be going for, and your chances of getting a good position is very, very high. It involves advising on strategic plans. Those are the job expertise, or what are the things that the employers are looking for, the job duties. This is what that particular portion is talking about. It involves advising on strategic planning, transaction, value-based care strategies, and governance, among other initiatives. The second highest revenue source is financial management and operations, and that is about 18.9%. Human resource and benefits project accounts for 12.9% of the revenue. IT strategy, which count for about 9.3% of revenue for healthcare consultancies. The remainder of revenue is made up of other offerings such as marketing, equipment planning, or practice management. So these are the areas that consultants are actually needed the most with all these skill sets. What are the main clients that you might want to target? Hospitals. Hospitals are the most common clients for healthcare consultants. If you're in consultancy or you're working as a consultant, yes, hospitals are the most common clients you will find. They need a lot of consultants in many aspects of their strategic management team. And then the next one is pharmaceutical firms or pharmaceutical companies. And the other one is other healthcare providers like private private practices and specialty hospitals or clinics. Specialties like acute care, home health care. Those are the ones that are healthcare providers that are private. Government agencies, like I mentioned earlier, Health and Human Services, and probably VA. Medical device companies, probably like therapeutical device sales or selling companies, or durable medical equipment companies. Those companies that produce the mass volume of medically supportive equipment that patients need. Maybe compression socks, eyeglasses, maybe adjustable spoons and sportswears, other wheelchairs, and a medical bed. Yeah, that's the one. And then the payers are probably the insurance companies. What educational background do we need to be successful in this career choice? Educational background to become a consultant could probably be a bachelor's degree in a related field. That will help you be successful. If you want to be a healthcare consultant, you definitely want to have a bachelor's degree in healthcare administration, public health, maybe bachelor's in public health with concentration in maybe change and all other aspects that maybe leadership, behavioral, any related program that you enroll in or took in your undergrad will be very, very helpful, or will actually set you up for success in this career. Many firms offer entry-level position to candidates who recently earned an undergrad degree. Candidates that graduate with an undergrad degree fresh from college can get great opportunity to work in most firms as a starter. So that's another option. However, many senior positions require more industry experience and advanced education. Yes, degrees like master's certificate in a very selective position or very selective topics of study will qualify you for this position. If you want to dive into IT and you did project management, you did information technology with a concentration of that in your MBA, it will set you up for higher or senior level position. If you have probably higher or a couple of years of experience in data analysis, you are great to take a senior position in a firm that needs healthcare consultants in information technology. Now in our next video, we're gonna dive down into how to become a healthcare consultant. What does it take to become a healthcare consultant? First of all, we just looked at the 5 major 5 major things we need to know before getting into this career. Now, after looking at all of this, we want to dive in how to become a healthcare consultant. That will be our next video. Thank you for watching.